joining us now, member of the New York Times editorial board, Mara Gay. She is one of the millions of people who was diagnosed with COVID-19 and is still recovering. The title of her latest op-ed for the paper quotes what her doctors said to her. "I wish I could do something for you." And in it, she describes her battle with the coronavirus, how lonely it was, and how primary care is considered an afterthought in the United States. Mara, great to have you back on the show. I first just want to ask how you're feeling, because I know this has had lingering effects. Your piece was incredible. How are you doing today?
Thanks, Mika. I'm doing much better than I was. I'm over a month in, though, and, just for viewers, I'm 33 years old, healthy. I'm a runner, never had asthma, never smoked a cigarette, and I still, at this point, am not fully recovered. I have lingering pneumonia. I use 2 inhalers twice a day. I can barely walk more than a few blocks without stopping. I continue to have to check my oxygen all the time, and so I am getting better every day, but it's been really a process. And with moderate COVID, which is what I had, apparently, it's about 6 to 8 week recovery for younger, healthy adults.
So that's the thing. You just mentioned it. I mean, you're 33, you're a runner, you were so healthy. There was no reason why you shouldn't have had a more a mild experience with this, and yet it was completely debilitating and still is. And what was so searing about your piece was describing lying in the hospital. You had one person next to you struggling, another person who was struggling, but yet you felt so lonely. And you only saw people's eyes over their masks and through your whatever was on you. And describe that experience if you can, because it's frightening.
Yeah, it was one of the most terrifying and thankfully brief, it was brief, but moments of my life. It's a very lonely disease, whether you're trying to manage it at home or, God forbid, in the hospital. I ultimately was able to leave. I didn't need a ventilator, thank goodness, but I was able to manage it at home. But, I live alone, so that was difficult. My family and friends were extremely supportive, and there was not a day that went by that someone didn't stop by to just bring me food or groceries. I have several friends who are in the medical profession who are able to manage my care at home. But the thing that I learned is how little information and care is available to people at home managing these symptoms. My experience is not uncommon. There are lots of folks who have a more serious COVID infection. And I think we're going to be finding that out more and more. It's not enough to tell people just stay home. It's really important that people know if they do have breathing problems, they need to go to the emergency room right away. If their oxygen dips below 95, if they are fortunate enough to have an oximeter, it's a little device that measures your blood oxygen and pulse on your fingertip. If it dips below 95 and you are sick and experiencing trouble breathing, you need to go to the ER. The government is running a PSA with Dr. Fauci telling Americans to stay home if they have COVID. I think it's very important that we take care to help people get through this virus at home. Germany is a country where there's at-home care. There are mobile units of medical teams that go to people's homes. And that would have been the ideal, certainly in my case. And that just isn't available for people. And it's pretty heartbreaking.
Jonathan Lemire has a question. Jonathan?
Well, Mika, first I should say that Mara has been a dear friend for years, and Mara, we're so glad you're doing better. My question for you is sort of what's next? Have you been able to have an antibody test, and if so, if you're comfortable saying, what did it tell you? And more than that, though, there is a belief that people who have had COVID-19 develop an immunity, at least for a time, to not be able to get it again. The science, can't say that definitively yet. Are you at all nervous about getting back out there, even in a limited way, back out and re-engaging society?
So I have signed up for the antibody test at Mount Sinai, which is where my doctors are. So I'm still waiting to hear about that. And I'm hopeful to donate plasma. That's what I'd really like to do, is pay it forward. I'm not super worried about immunity at the moment. I, of course, understand you can't make public policy responsibly with the assumption of immunity, but it does look promising. What I'm mainly concerned about at the moment is seeing what I can do as a writer on the editorial board to help New York get through this time. And I'm very worried about my neighbors who don't have the kind of support that I did. And I'm also just really looking forward to helping others as they've helped me.
All right, we're going to close by reading from your piece, Mara, which is so powerful. Why are more people dying of this disease in the United States than anywhere else in the world? Because we live in a broken country with a broken healthcare system. Because even though people of all races and backgrounds are suffering, the disease in the United States has hit Black and brown and indigenous people the hardest, and we are seen as expendable. I wonder how many people have died, not necessarily because of the virus, but because this country failed them and left them to fend for themselves. That is the grief for me now. That is the guilt and the rage. Member of the New York Times editorial board, Mara Gay, thank you, and we hope that you continue to feel better. Please come back soon.
Thanks, Mika.
And
thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.